Hi everyone, it's Dr. Hafez from Scholars Dental. In this video, we want to talk about the new ACS exam, the changes that have been made for the 2022 vision. And they're calling it now the NDECC exam. A lot has been changed, so let's get started with this new NDEB update. Hey everybody, welcome back. So this news was released on October 29th. Finally, we've been waiting to see what the update is and more details about the new ACS exam, right? And let's skip to here. You can see it says this is this December 2021, there is an ACS exam, and that will be the last time it's administered in its old format with the 12 projects over 2 days. And now the NDECC exam, which is the new name for the ACS exam, is going to be the third examination officially, because we know now you have to do AFK, ACJ, then ACS. Okay, it's been designed to assess the clinical competence of dentists from non-accredited dental programs. And here's the new part, a series of clinical and situational judgment requirements. So we don't know exactly what that means yet in detail. Let's just kind of look and see if we could find more information. Okay, so the clinical requirements are simulated on patients, are on simulated patients. So that's just the skills part, the projects, right? They're on simulated patients. So that hasn't changed. You're doing them on Kilgore teeth or on plastic Kilgore teeth, basically. This is for the clinical skills part. Okay, then it says there's also going to be a series of situational judgment scenarios. This will assess judgment required to solve problems in work-related situations. These scenarios will focus on patient-centered care, professionalism, communication, collaboration, and practice information management and health promotion. So the NDEB hasn't made it clear. Is it on patients, like actual patients? Is it on actors? Is it an interview? Or is it something written in like a booklet exam? Or is it on a computer? Is it computer-based? So this is the thing. We don't have that information yet, I think. So far, what we could say is this new NDECC, okay, we have projects, so ACS projects. And I know it's 7 projects, so we're going to get to that point. Plus judgment situations. Okay, judgment. It's going to write it in short, situations or situational, whatever. Okay. And that includes the topics we just listed here. All right, so the NDEB is expecting to administer the first in June 2022 in-house in Ottawa. So I thought it would have been Jan, but I guess it was not in Jan. Okay, so it's going to start, the first time they're thinking it'll be in June 2022. So starting there, things are going to be quick, because later on in this news, they'll say that it's going to be several or multiple times a week, right? So from this moment until then, you have 6 months where there's no exam, and their first exam is going to be in June. Okay. All right. Here they're just kind of recognizing how it's been a difficult time for people that want to do the ACS because of all the pandemic and the lockdowns and capacity restrictions. So now we have our own test center, right? The NDEB has its own center, and we expect to offer the NDECC multiple times a week throughout the year, creating ample opportunities. So that's pretty amazing and a big change. So multiple times a week. How many? We don't know, but so weekly exams is a really good step in this, and it was going to speed up the process for many dentists. Okay. And also, we know this from before, you're going to have the ability to do it unlimited times. So unlimited attempts within 60 months, right? So it's like 5 years, month. I mean, if you can't pass the ACS in 5 years, I mean, then I don't know what to tell you, but that means there's, and if you could do it every week, then, then there's a problem. You have to practice more. I don't know what to tell you then, right? So you should be able to pass it within that time if you have weekly opportunities to do the exam. Now, people could possibly not pass it in many years because it's only done twice a year. You might not get a seat that you could travel to. So it's different. But when it's becoming weekly, the only limitation may be then the cost. But they haven't spoken about the cost yet, right? Okay, so this is a significant change from the current regulation, which only allows you 3 times. Yep, it is. In October 2021, the NDEB board approved. Okay, so the blueprint for it, whatever, it's approved. All right, so that's the news part, or the official news part. Okay, this is the information we got from it. Now, there's another link that you could find also on the website under equivalency process, and if you go to the Vision 2022, right? Well, it's not working there, but you have to go down to the where it says Vision 2022, and you can see that arrow expanding. Here's where they talk about the equipment. Okay, this is also big news here. So the equipment, you will be provided with all necessary equipment, materials, and instruments for the exam. Information on the equipment of the test center, dental instruments, all this will be provided in a protocol coming soon. So that's going to be exciting to learn what instruments are they going to give you. So again, this is something worth to add here. All equipment will be provided. So now you might think, let's look at this, let's analyze this concept. You might think, hey, that's going to reduce the cost of this process by a few thousands, right? The equipment could go up to 10,000 or more. However, you still need to probably buy something to practice, right? So really, you still have to buy equipment to practice for your courses, right? So I don't think doesn't affect the cost. The cost will probably be similar, okay? However, some people, it is nicer to know that you're going to the exam and you don't have to worry about forgetting things, or you don't have to worry about traveling and carrying things to Ottawa. Everything is provided there. That is a relief. So it will be more convenient, right? I'll put a check mark on that. Like, yeah, convenient, okay? Cost, I don't think it's going to make a difference because you still have to buy equipment to practice. It depends on what equipment do they give you. Now, I have one question about this. Will they allow you, right, to bring your own if you want to? Okay, because I could already see, we already have seen people talking negatively about this point, that you may want to practice or drill teeth with specific instruments and the NDEB may not provide that. Now, we know the concept. If you're doing ACS, fender wedges are very popular. A fender wedge has that little strip so that you could put it between teeth and avoid damaging the adjacent tooth. So is the NDEB going to give you fender wedges? I don't think so. Maybe they'll just give you a regular wedge to give you some spacing. I think that's sufficient. You could practice with that. But let's say you bring your own fender wedge. Would they allow you to bring a little pack of fender wedges, or your own hatchet, or your own probe, or your own burrs? I don't know. That's something I would like to ask maybe and see if anyone has an answer. Please leave in the comment below. So that's a question I'm going to leave here. All right, let's continue. Where are we now? Okay, and the actual instruments, they're going to tell us about what the equipment they're going to provide in the practical guide coming soon. Now, there are invigilators there that, they're going to make sure you're following the protocol. If problems occur during the exam, including a problem with the equipment, instruments, or anything like that, you have to tell the invigilator, and then they may give you a time extension if you experience a cumulative delay of 5 minutes or more. So they might give you 5 minutes for each problem. So if you have 5 problems, maybe they'll give you additional 25 minutes. Sure. But no time extensions are given for tightening or repositioning teeth. Okay, so why would you need to tighten and reposition teeth? If they're providing you with everything, that's weird. So, I mean, I hope no one would need to do that anyway. Why would you need to reposition teeth? Well, maybe we'll find out later on during the examinations, right? Okay, so what type odonts? This is also big news. The teeth that you're doing the exam on have changed. This is amazing. This is so much more relief in time of your preparation, in cost in buying Kilgore teeth, the special teeth, the multi-layered ones, right? So the NDEB uses the Series 200 typodont. We know that. I think I have something open here. Let me just kind of show you guys. Okay, so I'm going to put this, add this there. All right. So, sorry about that. Okay. So the 200 series typodont, that's the one we use. That's the regular, that's the one that we've always been using. Okay. And the A21 are the pre-prepared teeth. Okay. So if you go to Kilgore's website, you'll see this is the typodont we use. And when they say A21, here's A21 right here. You can see that's the pre-prepared teeth. So if you click there, you can see you have the pre-prepared teeth, right? Now you're going to get, what are you going to get? So here you can see here, there's one for temporary crown. But let's go back to this and you'll see that it says it's only for class 2 amalgam, class 4 composite, and class 2 composite. So there's no temporary crown on pre-prepared teeth. Interesting. So you have to practice on the pre-prepared teeth, the A21. You want to practice on these three, projects basically. Okay, then you have the A5A N200 permanent replacement. These are what we call the plastic teeth, the $2.50 teeth. By the way, the pre-prepared teeth are also around that price. So that's a good thing. This is where you're going to do your metal ceramic prep, class 2 amalgam. Look at this preparation, class 2 amalgam. And look at this, the provisional crown restoration. So this is a cool point that you're not going to be doing your temporary crown on a pre-prepared tooth from Kilgore. You're going to prep your crown and do the temporary on it. This solves a lot of problems. So let's add this here. So another point is preps done on plastic teeth. Okay. So now if you analyze this point, you could say this will reduce the cost, right? Why? Because now you're not, students spend a lot of money on buying the special teeth. When you have each tooth around $10 to $12 and you want to buy like 20 of each or 10 or 20 of the 1/6, 20 of the 2/6, 20, it goes up to thousands of dollars. You could say 3,000 or something, right? So that's going to reduce the cost by a few thousand. Also, it's going to reduce the time, right, of preparation, of you training for this. Because we used to do the step of practicing on plastic teeth, then making the transition to special multi-layered teeth. Now you have to kind of learn the new consistency of the tooth and all that. So now you only have to practice on plastic teeth, and whatever, you get good at that, and then you don't need to relearn on the special multi-layered teeth. So this is a big deal too. Okay, so it's going to reduce cost and time of your preparation. You know what to expect. Plus, I think it's easier to do it on plastic teeth. Okay, in my experience, I found the plastic teeth to be more resistant, so they could kind of take your pressure. Less mistakes are to occur. Whereas in the multi-layered teeth, the special Kilgore teeth, the dentin is very soft and you could, cut through very easily by mistake, right? Also, that means there's no caries, I'm assuming, right? Let's check that. There's no carious teeth, so you don't have to remove caries. So class 2, here you have the class 2 amalgam preparation on these, so there's no caries, right? Also on the special teeth, the multi-layered, sometimes you get a gray spot when you're prepping. There's a lot of problems with them. So this is going to make things easier and more predictable for your exam. Okay, easier and more predictable. Okay, so good news. Then we want to add the concept. I'm going to have to scroll down. We don't have a lot of space here. Then we could add the concept that also your pre-prep or your provisional project is going to be done on your crown prep. This also solves a lot of problems. Why? Okay, so when you get a pre-prepped tooth from Kilgore, the plastic one that's pre-prepped, the A21, there's always been complaints about this thing. Why? Because usually the preparation on it is very thin. And then when you go to make a temporary crown, you sometimes get a thin crown. But at the same time, there might be occlusal interference, or it might be high on occlusion. So you have to adjust, and then you might get a hole in it. Always been problems with it. It's always been easier, in my experience, to do a temporary crown on a tooth that you prepped, because you could make it thicker, make the preparation adequate, and make the temporary crown stage easier. So I think this is great. Okay, so this is a good thing. It will make your provisional project easier and more predictable as well. Okay, so now you could say that it's become easier. Now, some people may complain that, hey, what if my crown prep was not that good? Now you're evaluating my temporary based on my crown prep. Well, it should be, maybe, because when you do it in real life, your temporary is going to be done on your crown prep. So I think this makes sense. And now you don't have to be responsible for the pre-prep tooth that's coming from Kilgore, which could be very thin preparation and could affect your temporary crown project. This is good news as well. Okay. So what else is there? Now, the only one that is still from the special teeth, we call them the special, is the S12 200. So that one is the endo teeth. Okay, so if you go to Kilgore, you'll find this one here. Okay, the endo, the access opening. So obviously they can't give you a plastic tooth for that, right? So they're going to keep that one. And I don't think anybody's complained about that. So, you know, there's a few things that this part here kind of explains some things about the teeth. Okay, so you could add a note here that access prep or endo prep still on special teeth. Okay, which is the S12. Okay, it's called S12, right? Yeah, S12 200. All right, I don't think there's anything important here. To simulate, there's describing the multi-layered made from uniform composite material with no demarcation between the simulated enamel and dentin. Fractures may occur if an attempt is made to remove a large section of the tooth structure or if excessive force. Okay, sure. Simulated pulp chambers. The simulated dentin pulp and canals are hollow, spaced line. Okay, there's describing these are metal. So sometimes in these teeth, the special ones, the Kilgore, use of metal hand instruments in teeth may leave a gray stain on the simulated teeth. So just be careful with that. If you're using metal objects, you may leave a gray stain, and that may look like you know, in the previous exams, it may look like you left caries. I'm not sure how that would work here. So we have some frequently asked questions here. Let's see. So what materials will we need for the exam? They are saying here they'll be providing all the necessary materials. So good. What type of simulators? ADECC simulators, sure. What brand? If I think that means like the actual. Wait, I'm not sure if they mean here is the head changing. I think no, the head's still Kilgore. Simulator, I think, is they mean here either the chair itself or the head and body. So that's something I'll look into as well. But I'm not sure. I don't think if they're using the Kilgore, you know, the Kilgore typodont. I'm assuming they're still using the same Kilgore heads and torsos, but they could be using a different one. Okay, but still, what matters is at the end of the day is the typodont. Okay, they're using the Cavo handpieces. Good info. So you want to practice with Cavo. I know it's been popular. Everybody's buying Jane Maritas, but now you probably want to get used to the Cavo handpiece so that you know you don't find a big change when you go to the exam. So that's one link. Now we have another link here that's talking about the NDECC. There's some repetition here. Okay, so the purpose is to, okay. Now here they're telling you exactly, you can see, you'll perform 7 clinical requirements on simulated patients, mannequins in a clinical setting, and 10 situational judgments. So let's add that to our notes, right? So you have 7 projects and 10 clinical situations. Okay, the NDECC will be members in a new NDEB test center in Ottawa, multiple times a week throughout the year. The first exam in June, same thing. Unlimited number within 60 months. Content. So let's see the clinical skills component. So here are the projects: Class 2 Amalgam Prep, Class 2 Amalgam Restoration, Composite Restoration Class 2, Composite Restoration Class 4, Crown Preparation. Then you have Provisional Restoration. The Provisional Restoration will be fabricated on the examinee's crown preparation. Okay, Endodontic Access Cavity Preparation as well. Wait, I just realized something. Is there one crown preparation or multiple? So I think we could go back here and see metal ceramic. Okay. So I guess they removed the full metal crown prep and they only have the PFM. Okay. So when you have only the PFM, are they only going to bring anterior teeth or are going to also add posterior teeth? Interesting. So I don't, because we do PFMs now on posterior teeth too. So are they going to say, hey, you have to do PFM, but it could be any tooth? You have to practice PFM on molars and anteriors? Or are we still practicing it on anteriors? Another question, I guess, I don't know if they'll tell us the details of that, or we just have to experience the first exam and then see what happens, right? In June. So that's another concept. So have they removed the metal crown prep, the full metal, and just made it PFM? And is the PFM going to be on the anterior or is it going to be on any tooth? Okay, so those are the 7 projects. Okay, and you can see that you have to treat the projects as if you are doing them on actual patient, and you have to use judgment in, okay, requirements can be performed in any order, infection control. So there's still kind of an infection control layer that they'll be monitoring you. So you could say 8 projects because there is infection control. They didn't remove that, okay? I'm not sure, they didn't make like a formal part, but they say that invigilators will be watching that. Now the exam is a 2-day exam. So let's kind of put it here, 2-day exam. All right. Now the situational judgment, patient care, these are the things. So you could read these here. Patient-centered care example: assess caries risk, manage patient's needs, gather data, sequence treatment, plan treatment. I think this is good. This is going to make things beneficial for people to enter the Canadian system when they want to work as dentists. Okay. Professionalism, manage referrals, social media appropriate use. Now, all this stuff is just, you can see how it is. Okay. But my question is, how is this done? Is it going to be an interview? Is it going to be situational where is it going to be actors on actual patients or someone acting a situation, you have to respond to it? Is it going to be computer based or booklet examination with multiple choice questions? I don't know. I hope we could get an answer to that soon when they provide the protocol. Okay, just problem solving. They're still not really saying in details. There's 10 situational judgment scenarios dealing with competency and patient-centered care. So we know the number is 10. The scenarios in the above table are examples that do not reflect all situations that can be assessed. What above table? Here? Okay, sure. I don't see a table. Again, you'll be provided. So here are some frequently asked questions. Where will the exam be held? We all know it's in Ottawa, in this center. Here's the address. Okay, you could get there by train, 4-minute walk, sure. And you don't need to carry anything with you because they're providing it. What facilities do they have? They have locker rooms, a lounge, including kitchen, even a meditation room. Okay, situational room, and a simulation clinic. So I guess the situational judgment rooms are separate. Will you be able to leave? If you leave, then you can't come back in. I read this, so you can't go out. What can I bring? So this is the one where can you bring your own instruments, I'm thinking. So you're allowed to bring your lunch, snacks, drinks, medications, if pre-approved. Interesting. Menstrual products. You must provide your own protective eyewear. Okay, they just said they're going to provide all the equipment. So this is a pretty important concept, I think, right? So bring your own protective eyewear. You're allowed to bring your dental loops. So loops are still allowed. You want to bring that. And your card. So here is the question. Are we allowed to bring our own, little instruments like burrs? If I have a favorite burr, or if I have a fender wedge, or if I have little things I like to use. That's the question here, right? What do you wear? comfortable professional sweatwear. They will provide a disposable gown for you, so you don't have to worry about that. And just regular infection control stuff here, like, you know, closed, don't wear slippers, wear actual shoes, okay? Try not to wear anything scented like cologne, because some people may have allergies to that, but deodorant is okay here. All right, so that's pretty much it for, I think I covered all the 3 links. Now let's look at the summary here that we got, okay? So pretty much I've covered everything I can here. If you watch that, you could close the video, but if you want to go over the summary with me, okay, so we have the NDECC exam starting in June 2022. So you have 6 months to actually figure out what you want to do. So, you know, you're not going to be taking the exam soon unless you're doing the December exam, which is the last exam for the old ACS protocol. You're going to have 7 projects plus infection control. So which projects have been removed? Rubber dam have been removed, right? Record keeping has been removed. Class 3 has been removed, right? It seems like FMC, full metal crown, has been removed. And that's 4. So if you remove it from the 12, that's 8 if you keep the infection control. So that's, okay, cool. Those, you know, the FMC could have been a problem. So then that makes things a little bit easier. And now you have 10 questions that are situational judgments. The whole exam is 2 days. I'm not sure how it's going to be distributed yet. Is it going to be projects on one day, then situations on the other day, or 5 situations on one day with 3 or 4 projects, and then, you know, split half that way? So we'll see. Our question is, what is this? Is it an interview? Is it on patients? Is it on actors? Is it on a computer-based exam or a booklet exam? It's going to be administered multiple times a week. Unlimited attempts within 5 months after you pass your ACJ. 5 years after you pass your ACJ. All equipment will be provided for you. So that's not gonna really reduce your cost for your training, because you still have to buy equipment to practice, but it's gonna make it more convenient in the exam. We want to find out what that equipment is that the NDEB is going to give you in their protocol that will be coming up soon. We'll make a video when it does come out. Can you bring your own? That's unanswered. We still want to find out if you could bring your own stuff if you want to. Preps done now are on plastic teeth. So this will lower the cost of your preparation and the time, and it'll make your exam experience easier and more predictable. The provisional preparation or the provisional crown is done on your crown prep, not on a pre-prep tooth. But the endo prep is still on special teeth. So I think that's pretty much it. The summary, a lot of changes. And another thing you could add is, we thought maybe they're going to add OSCE questions, like from the OSCE exam, but it's not OSCE, it seems like. It seems like it's something possibly new and different. We'll see what it is. And yeah, that's it. I think that's all. And I'll see you guys in another video. I hope that was beneficial for you and you learned from it. And good luck with your ACS exam in December, or your AFK in Feb. Or if you're waiting for the June one, good luck with that as well. And I'll see you guys in another video. Goodbye.